I'll start off by saying good morning, good afternoon, and good evening to everyone who is joining in. Thank you all for joining us for our first webinar of the academic year at the Palestine Program for Health and Human Rights. My name is David Mills. I'm a part of the leadership collective of the Palestine Program. I'll kick off our discussion with a brief background on the 2023 Palestine Social Medicine course, and then we'll jump into our panel discussion with our incredible and inspiring group of students who will be sharing their experiences and reflections from this past summer's inaugural course. For those of you who are joining us for the first time, the Palestine Program for Health and Human Rights is a partnership program between the FXB Center for Health and Human Rights here at Harvard University and the Institute of Community and Public Health at Birzeit University. The Palestine Program seeks to bring a transformational framing to the understanding of the structural and social determinants of Palestinian health through knowledge production, education, and community action. I'm excited to say that we're entering into our third year of operating as a program, and we are excited to continue the work we do into the future. Before we start, I want to acknowledge recent events in Palestine. At the Palestine Program, as an academic and educational program that seeks to provide protected space to engage in work focused on health justice, we condemned the Israeli raid of Birzeit University on September 24th and stand in solidarity with our colleagues at Birzeit University. These raids violate the right of Palestinians to education, freedom of speech, and freedom of association. So we'll get started here, and I'll just give a brief overview of the Palestine Social Medicine course to ground everyone in the context of the panel discussion. The first inaugural Palestine Social Medicine course was a partnership course between the World Health Organization and the occupied Palestinian territory and the Palestine Program for Health and Human Rights. Drawing from the legacy of social medicine courses that have been developed by organizations such as Equal Health and the Campaign Against Racism in settings across the world, we sought to develop a 3-week intensive and experiential course to expose students to the structural and social determinants of health that affect Palestinians and that are many times left out of traditional allied health education. We centered the class on a definition of social medicine put forth by the Social Medicine Consortium that we found to be the most comprehensive of the objectives of our course. And this definition was the following: that social medicine is an approach to health that recognizes the centrality of social and structural determination of health, integrates social theory and understanding, social theory to understand social forces that marginalize and harm communities, and builds collective power to challenge oppression and support the struggle for social justice. In week 1, we utilized critical theories and frameworks to help ground students in the historical, the political, and the social drivers of Palestinian health. In week 2, through guest speakers and field visits, we applied those frameworks to the Palestinian health context. And in week 3, we drew on examples of health organizing from Palestine, Latin America, the United States, and across the world to discuss how we can start to think about creatively and collectively developing initiatives to challenge the structures that lead to poor health for Palestinians and other marginalized populations across the world. We had a cohort of 30 students enrolled from an applicant pool of 200. We had students coming from the Gaza Strip, from the West Bank, and from Harvard-affiliated programs. This was a multidisciplinary group of students that included medicine, public health, nutrition, pharmacy, social work, and nursing students. We had over 22 organizations represented by our guest list, or by our guest speakers. Those guest speakers included medical practitioners and health experts, scholars, activists, and community organizers from governmental and non-governmental organizations, civil society, academic institutions, and medical and human rights organizations. The ability to bear witness to issues related to Palestinian health was the impetus to provide a strong emphasis on field visits, which included visits to Jerusalem, Jaffa, the Nakab Desert, Hebron, and the Bethlehem and Ramallah areas. And once again, we are incredibly grateful to the WHO for their role in helping to facilitate movement for students across these geographies. As you will hear today, this was an incredibly powerful, emotional, and at many times challenging 3 weeks for the students, but also all of the instructor group as well. And to finish up, just a few points on why we're holding this webinar. There's a couple of different reasons. One, we want to highlight the amazing students from the 3 distinct groups that participated this past summer. We want to use this as a way to advertise to future students about opportunities to join the Palestine Social Medicine course this upcoming year. And lastly, we are looking to confront not only the geographical fragmentation of Palestinians, but also the fragmentation in how Palestinian health is described and studied. And this is really what we mean by reassembling the pieces. Our objective is not only to bring together Palestinians from across occupied territories and beyond, but also bringing together an integrated, a multidisciplinary understanding of Palestinian health to tell the complete story of the social, structural, and political determination of Palestinian health. Without further ado, I will pass the mic to Dr. Wiam Hamoudeh, who will introduce our distinguished panelists. Thank you.
Thank you, David. Hi, everyone. My name is Wiam Hamoudeh. I'm an assistant professor at the Institute of Community and Public Health at Birzeit University and one of the members of the leadership collective of the Palestine Program. So I'm going to introduce our wonderful students that are going to talk about their experience today. So first we have Ahmed Hamada, who's a medical student. He's a sixth-year medical student from Gaza, Palestine, and he's currently completing his studies at Al-Azhar University. And then we have Erica Willesee. Erica is a Doctor of Public Health student at the Harvard School of Public Health. She entered the program after more than a decade of service in the Global Health Program implementation at the U.S. Centers for Disease Control and Prevention, the CDC, where she developed and supported national public health institutes in their capacity, building strategies, creating opportunities for effective policy change and entrepreneurship to support the development of stronger public health systems. Additionally, she supported numerous emergency and humanitarian response efforts to support displaced populations, refugee communities, and other marginalized groups, as well as the workforce that aims to support them through crisis. And then we have Farah Miqdad, who is a fifth-year medical student and community advocate at Al-Quds University Al-Azhar branch in Gaza. Farah is passionate about bridging healthcare and community well-being. She completed intensive training in social medicine and led over 15 impactful projects and activities in the past 5 years. She's a supervising council member at the Palestinian Medical Students Association, where she has been volunteering for over 4 years. And then we have Susanna Salak. Susanna is from Hebron, Palestine. She graduated from Birzeit University with a BA in Nutrition and Dietetics and a minor in Business Administration. During her studies, she worked at the Palestine Medical Complex Hospital. And Susanna will join the Center for Freedom and Justice, which is a Palestinian nonprofit organization based in Hebron. And then last but not least, we have Cecilia Zal. Cecilia is a Master of Science student at the Harvard Chan School of Public Health in Neuropsychiatric Epidemiology and concentrates in humanitarian studies. She's been working toward eliminating structural barriers to mental health care as a researcher and founder of a nonprofit organization. She is passionate about promoting global health equity, access, and human rights, and has experience working with diverse and marginalized populations. So I'm going to start off with a general question. So after your experience this summer, what is the importance of the social medical course lens to you, and how does it contrast to traditional forms of education and health that you've received so far? And I think Ahmed will start us off.
Yes, good morning, good evening, everybody. To answer your question, I'm serious enough, I think, when I say that my perspective has been shaped in a way that there are two eras now, a pre-social medicine course one and a post-social medicine course perspective. So what this course has really offered and what this course has really added to me is that it has formulated a whole new concept in our minds, which is the concept of social medicine. I believe it is not a new concept, globally speaking, but it's gaining so much interest in the latest years. Before this, and speaking of the case of Palestine and the fact that we are health specialization students, we have been repeatedly, directly and indirectly exposed to the components of social medicine without even noticing this. For example, when I am asked to take history from a patient as part of my role as a student in my clinical patients. Part of the history taking should be about the social elements like housing conditions, crowding, animals keeping, ability to provide the medication, accessibility. And to be honest, I gave these elements a little or no attention in the past because I wasn't recognizing how impactful these factors could be on the patient's condition. And actually, unfortunately, I now know that they are even more important than the disease process itself. And the proper counseling for a patient could not be without addressing these elements. And I now know that social elements are broader and even more complex than this, especially when viewed from the perspective of Palestinian context. However, being part of this program has changed many things for me. I've had the privilege of interacting with many fellow participants from all over Palestine, Palestinians living abroad, as well as our closest friends, whom we proudly announced as Palestinians through this course. It has been inspiring to witness their unwavering curiosity about our shared cause, and each one of them who I witnessed is tirelessly working in their respective fields to make a difference. And seeing this collective dedication and the determination to bring about positive change has revitalized my hope. And it has shown me that despite the challenges we face and the hardship we endure, that there is a vibrant and a resilient Palestinian community working towards a brighter future. And it's no longer for me, like, it's not about leaving my country anymore. It's about leveraging our shared experiences and incorporating insights from the outside world to craft a brighter future for ourselves and for generations that follow. Thank you.
Thank you, Ahmed. I'm gonna hand it over to Farah now to respond.
Hey, hi everyone. It's really nice to see everyone back together. Adding to Amir's point, it is one of the first things that we learn in medical school as fourth years is how to ask questions and how to take the history of the patient. And we've always learned the components of social history, and we never thought to ask about the reasons we ask these questions. And usually when it comes to practice in the rotations, when you are actually talking to patients, we only focus on three things: asking whether they smoke or not, whether they have any pets, and sometimes we ask about their social economic status. But we never cared to ask about how is the situation they're living in. If they're not working, why are they working? Whether they have any family members living with them. Is there any people around them having similar symptoms or signs? And I never thought to think about these things until I went through social medicine course and started to look at patients as more of a structural view and taking few steps back when evaluating the people that I see in clinical practice. And it always makes me wonder, what if we added 2 or 3 minutes when talking to patients and understand more about their whole story, not just the biological signs or symptoms that brought them to the hospitals. And then we get to the question of how, as a doctor, I can help integrate this patient into a whole system where they can get the multidisciplinary care they need, or how a health system in general serves this patient. And this brings me to think of what Rita Jakaman has talked about in one of the lectures that we had in social medicine course, when we talked about the continuum of health, illness and health, and how it's an ongoing process that as a student I would have never learned to think this way until I was exposed to the concept of social medicine and the approaches that we need to bear in mind when dealing with patients, and try to provide them with the best care possible for continuing to have a healthy life rather than treating a disease with few meds or, Yeah.
Thank you, Farah. I think you both bring up really important points in terms of how, oftentimes medical students are trained to think about health and it tends to be in a more narrow way, and then also linking it to the broader context of even when you're in Palestine and there are these broader structural issues, they might not necessarily be connected to the way that you're even taught about health. I'm going to hand it over now to Cecilia, who will also bring in a more international perspective to the question as well.
Hello, everyone. It's really great to be back and seeing everyone's faces. So for me, I think the highlight of this course really culminate in, as everyone said, about the social medicine framework. And as someone who are kind of trained or study in epidemiology, we were really exposed to the idea of like working with big data and seeing how there are causal inferences between one factors to another and how these determinants shapes individuals' health status. But it's really, there's an inadequacy of seeing the causes of the cause is who really shaped the overall hierarchy or overall picture of individuals' opportunity to access healthcare or their rights as human beings to deserve in certain way an amount of healthcare delivery, etc. So for me, the highlight of this course really is to ask the question of, who is accountable and who is responsible for individuals' health status, especially in the context of Palestine. So, and I think for me, what I learned a lot about really applying this social medicine framework is to kind of gauge the question that who should we ask the question for? And in the picture of Palestine, where health or public health is inextricable to the ongoing Israel settler colonial project and the ongoing dispossession and erasure from their voices, and how the current structure is basically reinforcing that project in Palestine. We have to keep asking that question, like who is accountable for the people's individual health and their right to access healthcare.
Thank you, Cecilia. I think David will ask the next question.
Great, perfect. And thank you for all those incredible answers. And, just one thing I picked up on is, really part of the course too is, and for us is really thinking about, you can't get to the right answer unless you're asking the right questions. And so that is part of, and really ingrained in this type of thinking is are we asking the right questions to get to the right answers, especially around questions of, individual health, accountability, these types of things. So thank you all for those really great responses. I'll pose another question to the whole group. And this revolves around what we're talking about as well, but it kind of takes it in a little different direction. Would you be able to comment on the makeup of the student group from geographical representation or from the multidisciplinary makeup of students, and how you think that impacted your experience?
I'm happy to comment on that, David, if that works. So in some ways it feels odd to talk about this because I honestly feel like the people that were part of this program are in such a special way connected to me. And I feel when I'm speaking about them, about the way in which they enriched the experience, I don't mean to take away from that bond that we established at all, but it was absolutely essential to the experience that we had such a diverse group that was from so many parts of the Palestinian territories, also, Palestinian Americans and people that were from a variety of different countries that were sort of brought together by this underlying interest and desire to understand social medicine in action and the Palestinian experience. But certainly there's classroom learning, and classroom learning is essential, I think, for establishing foundational knowledge. But the realities of the experience, the realities of what social medicine can contribute to people's health, to people's life, and the realities of the Palestinian experience itself really just came alive in a way that I don't think it ever would have without having such a diverse cohort. Particularly our Palestinian friends that were part of this group. I again, it was, we had classroom discussions and we were all sort of there, rooted together. But at the same time, it's a lot of the discussions that we had that were outside of class about the realities of what people's lives are like, and how something that, as an American, where I frankly, my media has been biased by the American relationship with Israel. It had seemed like such a sort of far away thing. It was something that was a bit more of a story to me. But having these friends, having these opportunities to really more than interact, but actually share together and sort of walk together in this experience and seeing these things and in understanding this context better was just transformative. And I think it's absolutely essential to the experience. And one of the things that, I don't think anybody can fully describe how great it was to have that opportunity, along with, the structure of the course and the way it was planned. That was just an addition that it's hard to fully explain how much it added to the richness of what we learned, but also how impactful this entire program really was.
Great, thank you, Erica. Suzanne, I see.
Yeah, hi. I would also like to add to what Erica said. So basically, having people from different specialties, we were also from different ages, from different geographical regions. It's not just about like learning from them, although we learned a lot of things. It also, whenever someone said something new, it made us like have more questions to ask. And one question after the other, it made us realize a lot of things. Like even, for example, us as people from the West Bank and those living in Gaza, we were still in Palestine, yet we don't really know much about each other, because what we only know is through the social media rather than what's actually going on. So it really helped us get to know new information, and it also made us realize that there are a lot of like-minded people around us that we can connect on another level and maybe make a difference in the future. Also, it really helped us know that, for example, we were from different specialties. You said nutrition, medicine, and for example, pharmacists. We were all together, which also made me realize as that we're not just we're not here just to do the role like as it is, but we're rather here as a whole like healthcare system together, which can make a difference in the community, because we're all part of a community, whether we are living in America, in Palestine, or other regions in the world. So it really did affect me. And I mean, we have a whole network now going on, which is like really great and amazing, and we can discuss our ideas, whether through Zoom or like WhatsApp or different things. So it was really valuable to have people around us to grow and learn. Thank you.
Thank you, Susanna. Any other panelists would like to comment on this question?
Can I just say one additional small thing is that I think as a result of us being in this joint experience and sort of having a more holistic, in a sense, knowledge of what is actually happening. And, Susanna just touched on the fact that I don't think it was as clear to me how much the Gazans and the West Bank folks don't know what's happening with one another even. So even that was a kind of a revelation. But what I really wanted to say was, I think because of the interaction that we've had and because of this experience that we sort of shared together, I feel like we're partners in a journey, and that we're partners in this fight. And while we all may have different roles to play, depending on where we are or what our, clinical or professional journey is, there is so much power in knowing that you kind of have this collective group. And they're more than just, people on social media, but people that you really understand in a totally different way and are connected with. So I just wanted to add that.
Yes, if I may add one thing, is that as Palestinians, we never got to realize that we do see Palestine differently. Like our experience of what Palestine is has always been different, especially when it comes to being like from Gaza and from the West Bank. You always know that there are like everyone is struggling differently in different areas of Palestine or going through different structural issues, yet you don't really get how it is, or you don't get to fully understand it unless you hear it from those people and you hear the full story of these people. And we touched on that a lot when we got to visit different parts of Palestine and see how it is. Like I would have never imagined that it would take us like 80 checkpoints to get through Hebron, or like what it's like to wait on a checkpoint. We've always heard about this. We know we do struggle with getting out of Gaza, for example, but we didn't understand that as much as we are suffering, other Palestinians of different parts are also suffering in their own ways. And in more health related issues is that across Gaza, for example, like an ambulance takes for around 15 minutes, but it never occurred to me that there are villages in Palestine where an ambulance doesn't even get to there, or it takes, sometimes they don't even come at all. So listening to these stories has helped us understand that what it's like to be Palestinian fully, and not that there is the beyond there that we never got to see, what we only heard about from our grandmothers and grandfathers. Thank you.
Just a little adding to Farah's point, especially for us from people from Gaza who were born around the year 2000. The only life we have experienced is the life under siege, and our only significant knowledge about our country is that for a better future you should leave. But after attending the course, there was a great shift in my thinking in regard to this point. Although I was overwhelmed with despair, and the idea of leaving and not returning has consumed my thoughts, but seeing people from different places, this amazing collective of participants, every one of them playing a vital and resilient role in his respective field, all working toward a community, toward a brighter future. So this newfound perspective, like it has ignited a fire within me to contribute to the case in my own way.
Great. Thank you, everyone, for all those comments. Just a couple of things I picked up on is, again, really the idea of this geographical fragmentation of Palestinians, and using this course as an example of being able to, again, bring folks together to learn about other situations that as Erica mentioned as well, that we all we're learning in during the course. But also think about the multidisciplinary approach, having colleagues from across specialties and, developing, new solidarities and new respect, I think is also very powerful in medicine when we essentially end up in silos when we're taking care of patients. So that's another component that I hear from the discussion here. Maybe I'll pass it over to Wiam.
Yeah, no, this is great. And I think this is also a good segue for our next question. So we were just wondering whether you can share a specific speaker, field visit, or other experience. As David mentioned, we were, part of this course was also experiential learning, either learning from the experiences of people on the ground or actually going to different field sites. So we had I think 5 different field trips, but also, like David also noted, speakers from almost 20 different organizations and backgrounds. And I'm just going to maybe ask a more specific question. Like, Susanna, when we were set to go to Masafir Yatta, most of us couldn't make it because of the closure and the checkpoint. And by the time we arrived, about 5 hours later than we were planning to. So can you tell us a bit about your experience as being the only student that was actually able to make it, And Susanna was able to make it because she was actually in Hebron and was able to go, but all the entry and exit out of Hebron was closed at that moment in time. So we were actually stuck at a checkpoint for hours without being able to go forward or backwards. So if, Susanna, you can tell us a bit about your experience being the only student that was able to make it, and also as being somebody from Hebron who's never actually been to Masafir Yatta, which is also not that far from you technically.
Yeah, of course. So basically, as you said, I was the only one who was able to get there. I was with the Palestinian Medical Relief, and we went there. It took us about 2 hours, 2.5 hours to get to Masafir Yatta, which is not very close by. And yeah, it was my first time going there. Actually, the roads were very bumpy. There was a lot of heat. The place there, when we got there, it was more observational rather than, learning from someone as a tour guide or something. So basically getting there, you can see that there are no actual houses or homes for people. They were merely houses because, as I heard from the people who are living there, a lot of them had to rebuild these merely houses, and they were demolished 10, if not more times. The occupation would come and demolish them every time, and they would still decide to build them again. They would resist to leave the place, even though the occupation would do a lot of things, such as scaring the children off, such as the demolitions that took place, the stealing, the settler attacks. A lot of things were happening there. And in terms of the healthcare access, the clinics are not allowed to be built there. So everyone would just wait for the Palestinian Medical Relief van to come, like every Saturday. And they would gather in a house, and they would ask for medicines and for medical prescriptions. But then you realize that they lack a lot of information in regards, like the basic information about health. It was very devastating to hear the stories. One of the most shocking facts or things that I learned is that because they don't have healthcare access, they would sometimes take medicines from each other in order to reduce the pain, because they were not able to seek any medical help, not just because it's far away, but because there was no transportation except for some people who had a mini car, and you can't always take the car from another person. So also there was a lot of electricity cuts. The water was not always available, and these are only the little things that I was able to hear from the people while staying there for about 1 hour or two. So I kept wondering, I mean, if only 1 hour or two would, you would learn all these things. I think if even if we had to experience the whole thing and staying with them for a longer period of time, we would even know more shocking facts and things that should not be normal to them, that should not be normalized. And this field trip was it made me realize that even though we're still within a few kilometers from each other, it still meant that we are having different struggles even in the same city. So it was very, very hard. And I'm sure you guys lived the whole experience of being stuck on a checkpoint for a few hours. So yeah.
Thank you, Susanna. And I mean, this also echoes just how that broader political context and the structures really impact health. And I've shared 2 links just for some background in case people want to know a bit more about Masafir Yatta. But you also talk about that fragmentation. So technically you're in the same district of Hebron, but it's still almost it's, very far away, even sort of mentally and just in terms of what the situation is actually like. Farah, you guys are, and I think for us, it's we hear a lot about Gaza and especially, in the last several years, all the different wars on Gaza. And we know how difficult it is for anybody to really get out. And it's been termed an open air prison. So can you tell us a bit about your experience from when you, I guess, got accepted to the course to coming, and what sort of and what stood out as part of that experience in terms, whether it's like actually being able to come to Birzeit, but also the different field trips and experiences that you had during the course.
So about the learning process, it actually began way too early. It began the moment that.
Ahmed, if you can get closer to the mic, please.
Yes, sorry. So about the learning process, it actually began way too early. Began the moment that we received the acceptance email. And to be honest, I didn't give like much hope for this, and I kept my probabilities as low as possible in order not to get disappointed. Because leaving Gaza to the West Bank is like, for a 22-year-old male, is like needs a miracle. And even people above the age of 50 can't dream of this. However, when I got accepted, I started considering the fact that this actually may be true. So I began to search about the permit regime. I asked people who are relevant to the field about their experience. How safe is it gonna be, and is it true? Because like there is a common sense here that people cannot go out of their homes in the West Bank without being shot. So, is it really true that we can travel alone there? And on the other side, working with my family to convince them that this might actually be true, to go to the West Bank. And sometimes searching about the cities we are going to visit, and commenting on the field trips. There are two journeys like that were the most impactful for me. The first one was the field trip to the Negev, where we witnessed how the Bedouin people are committed to their cause, and they are attached to their land and cause. And this is simply the way they live. They are not trying to pretend to be like committed to their land, but they love the way they live. And the second field trip was the field trip to Yafa, just because I love the sea and I eagerly wanted to have the experience of swimming and sea outside Gaza. So although it's the same one here and there.
Okay. As for me, like, I guess it's for all of us who left from Gaza that we tried so hard to keep our expectations as low as possible, because there's always, usually as far as I knew back then, that you get a message around 24 hours or even less than that prior to leaving Gaza. So until the last moment, we're actually crossing the border, even after crossing the first border of 3 borders that you have to cross to actually be out, you're still 100% sure that you're actually going to leave. I had experience going through the border before, and it was like 6 years ago. But for this time, I noticed that there is like much more restrictions than before. So I had to do more research about this, and asking about to be honest, it is, it might not be that big of a deal, but like for everyone else, but for us, you also have to think about getting, for example, your personal hygiene stuff. You need, you're not allowed to bring them with you. Like for us, I don't know, makeup, soap, shampoo, or like all these basic things you're not allowed to bring with you. So I was thinking, if I'm gonna buy this, where I'm gonna buy them from. And of course, our instructors and mentors were a great help in that. And we voiced that out and we talked about it, and they were of great help getting us like where to go and all of that. But you still wouldn't understand that, when do I need to do this and how can I get there? Or what about the transportations? For example, I had friends whom I've known from the West Bank for 4 years or more, and we always talked about doing activities there, but yet I always have the same question of how do you get from Ramallah to, for example, Nablus, and how long does it take? Or like, is it possible to actually go between the cities? What cities can you go through and which roads can you take? So all of this was like a lot of things to learn and things that you usually don't experience within Gaza, but yet it's a whole different experience there of how to get between cities and crossing borders and checkpoints. So I guess the learning process started when knowing that we're gonna get there, but not being certain until we actually cross the third border and met Shiraz on the other side. And even getting back was a different experience than getting out of it. So it's still an ongoing learning process, and it's getting more clear to us and helping us to talk more about it and know how to talk about it to other people who don't really understand the whole situation.
Great. Thank you so much for all those incredible responses. I want to ask, I know we have about 15 minutes left. I want to ask a question out to the group that kind of just thinking about the whole experience as a whole. I want to ask, what was the main takeaway from you from the course? And then also thinking about moving forward, how do you see the social medicine course factoring into your education or your career or career ambitions going into the future?
Actually, my main takeaway was inspired by you guys, our great instructors, who dedicated a great time to make this 3 weeks intensive course come into life. So the most significant lesson that I've learned that was about the immense value of even the smallest efforts. And it became clearer to me that every action, no matter how seemingly insignificant, contributes to the larger goal and can make a meaningful impact. The collective power of these efforts is what actually drives a positive change and a progress. And to be honest about the career pathway, it's really vague for Palestinians, especially those in the medical field, to know what they are going to do in the future. Although we have dreams, we have interests. For me, I'm interested in oncology and research, but I'm not sure if I am gonna do this actually. I'm going to work hard to get this, but there is a bunch of it that depends on luck. So if I am lucky enough, then my ultimate goal is to dedicate my degrees, my specialty, for the sake of serving cancer patients in Palestine.
Great, thank you. Maybe I'll pass it over to Cecilia.
Yeah, so for me, I think the main takeaway is to really think with the Palestinians and also think with the oppressed communities who are all across the world, and having to see public health or social medicine as a powerful tool to stand by their position, and also seeing the voices, their rights being denied under impossible political situation is a way or a key beginning point to stand by their position, and how also to move beyond the current employment of basically a purely biomedical framework, clinical framework, to a more politically oriented and also politicizing everyone's rights towards healthcare access. And for me, I think also the most important part is to think beyond the picture that are currently facing by the global communities, and also bond together, as Amr just said, to see who are the friends and who are the allies in the picture, and how we, as international students, for me, I'm non-Palestinians, I'm coming from China, is to really feel the responsibility as a global citizen to stand by their shoes, and also thinking about ways to mobilize our current resources and current mobilities in a way that to push the boundary and advocating for human rights and the restoration of the political rights.
Thank you so much, Cecilia. Sorry, Susanna, did you want to? chime in?
Hi. So I also wanted to say that the social medicine course, it wasn't only just about, like for me, not just about understanding the determinants that led to, like, that affected the healthcare and the healthcare access, but also to me it was more of understanding who I am and who my ancestors was and where, and the history behind, like, for example, for a person who've only been to Jerusalem about 2 times. So being there, going there, understanding what was going on, learning from the people, from the tour guide, from you guys, going to Masafir Yatta, going to Yafa, learning all the stories behind was very important, because like to a certain point you feel like you've had enough, because I mean, like there are martyrs every day, so feel like you've had enough of the situation, even as a Palestinian who's looking, like, who's trying to be more resistant to what's going on. And also it was very important to understand that there were a lot of, like, ways of how people resisted the occupation and what was going on, and ways that they were trying their best to, like, achieve health, even if it was at the minimum level. So I think all that was very important, because once you understand who you are and once you understand what you really want, which I realized I really want to help the community grow in any possible way, which is why I joined the NGO that I'm working at right now. So this was the main takeaway for me. So I really thank you guys for this course. Thank you.
Thank you so much, Susanna, and thank you everyone for all your very insightful comments. Before we have about 10 minutes left in the program. Before taking a couple of questions, I actually want to introduce and pass it over to one of our esteemed colleagues and guests, Dr. Benjamin Bouquet. Dr. Bouquet is a medical doctor and public health officer for the World Health Organization based in the occupied Palestinian territories. He's been working with the WHO for over 7 years at least. And he will give us a couple minutes on some of the takeaways and the learning points from the WHO perspective.
Thanks so much, David, and thanks, colleagues. And yeah, it's so great to see you all again. Yeah, I mean, I want to just echo many of the points that have already been raised by the students that attended the course. I think this was also a learning for us, and really reaping the benefits of all of the work that David, Wiam, and the team put into the development of the course. And I think, I mean, maybe just to take a step back and kind of come at this from the WHO angle, our program is focused on the right to health. And so what that means is striving for achievement of the highest attainable standard of health for everyone. And this sort of, sometimes we get lost in these very lofty ideals and things that we're striving for, and what does this really mean on a practical level, particularly in a situation where you're witnessing such injustice. And also that can really create, I think for all of us coming into the course, I got that sense that we came in with a sense of also powerlessness when you see such injustice, such violations, and you want to change and you want to create a system where there is protection for everyone and that there is respect for the right to health and there is fulfillment of that right. And so this was really an opportunity, I think, a space that was just incredible. And I think you're getting a sense of that from the way that the students are talking and the way that Wiam and David have talked as well, of a space for reflexivity, for understanding our own position within structures of violence and what our own potential contribution to those can be, both positively and negatively. But it also created a community space, a community where we can sort of understand what our collective action can be going forward, which is about understanding, as people have mentioned already, the different role that people have within, you know, different institutional settings, within different geographical settings, with different lived experiences. And we have so much to learn from each other. And I really think that there was also, you know, such an opportunity to just listen as well. And I was very humbled by what the students shared in some of the sessions. I mean, just incredibly difficult experiences that people have been through. And it really gave us a sense of urgency moving forward about, you know, wanting to tackle these and to support Palestinians and their right to health. So I hope that gives some insights over from my side.
Thank you
Thank
so
you, Ben. We really appreciate it. Oh, sorry, go ahead, William.
No, it's okay. I was just gonna say thank you, and we really appreciate it. And also, I think it was great having the WHO as a partner on this, and this was also partly a big part, actually, of how we were even able to get the students from Gaza to be able to come to Birzeit. And yeah, and that partnership I think was essential, and we hope to be able to do it again in the coming years. We don't have a lot of time, and you can always add questions. And if we don't get to your questions, maybe we'll try to type the answers as we're going. But I'm going to start with one question because I think it touches on the last 2 points that were mentioned both by Ben and Cecilia. And we have a question from Abdul Latif Husseini, which said, do you think that the course is useful for you in understanding and dealing with your own communities? And if yes, how? Cecilia, do you want to start since you kind of started on this point?
Sorry, my Wi-Fi just cut off a little bit. Could you repeat?
Yeah, so the question was, do you think that the course is useful for you in understanding and dealing with your own communities? And if yes, how?
Yes, definitely. I think the course is very impactful in a way that taught me how to think about illness, think about well-being, mental health in a way that recognize the collective version of it instead of focusing on the individualities, and which is sometimes a default mode when we talk about health practices, is focusing on the medicalization. And for me, I think thinking about my own community or the community I was being part of throughout my journey of being a nonprofit organization is the idea of bonding with the people and actually learning how to change this current situation in a way that is productive in the longer sustainable way, and thinking how should we move beyond the current situation in terms of tackling actually the key issue. What are the social determinants? What are the structural violence being predisposed in the picture? And for me, I think primarily what is important about actually from the beginning, what I mentioned is the accountability, is to actually pose the question right, and also to the right person, is to kind of thinking about, okay, this issue, given that it's not supposed to be posed on individual patients, or our collective violence, collective disease are superimposed by a bigger framework, the social, the collective determinants. So how could we actually ask the question to the right person and then address them in a collective manner?
For me, I just want to say that, as an American, I sort of grew up being a person that was aware of news. I grew up in a very politically focused household, and so I was very aware of the situation. But in general, the response that I frequently received in the community that I grew up in, and I think a lot of Americans get this, is the situation is complex, or you don't understand. And so it's almost like puts this barrier for you in speaking about it, or in thinking about, where there really is true injustice there, and where there is maybe no question that it's injustice. And so one of the things that I feel like the course has brought to me is the fact that I feel that we have to speak up. And I feel like there's things, yes, this is a complex and 70-year plus situation that's been happening, but without question, there are things that are without question injustice, particularly as it relates to health, an issue that I do have a lot of knowledge about. And so I don't think that saying, oh, it's too complicated to talk about, or it's too complicated to engage in, is acceptable. And I know there have been a lot of other people who have come to this realization long before I did. But I'm hoping that because of my, sort of engagement here, and also my sort of unquestionable belief in the fact that there should be some investment of my time and the time of a lot of the other smart people in my life in public health or otherwise, I really am very committed to trying to find ways to be involved and to be present, but also to even bear witness to what I saw and the people I met and the action that's necessary moving forward.
Thank you, Erica. So I think since we only have 1 minute left, I'm going to hand it over to David for the closing, and I'll add links to the website and also a promotional video that we just completed about the course in the chat for anybody who wants to look at them.
Great, thank you so much. Time really flies during these webinars. I wish we could stay on for another 2 hours, but in any case, I want to thank our guest speakers for your time. It's been an honor to be part of this panel discussion and obviously being part of the course with you all. I would also like to once again thank our partners at the WHO in the occupied Palestinian territory for their endless efforts in the planning and implementation of the course, as you've heard throughout this program. Please continue to check our website for the application cycle for the second annual Palestine Social Medicine course that will be taking place in the summer of 2024. And just one other note about the Palestine Program for Health and Human Rights, we will be holding several events and webinars throughout the fall and winter. So please, again, continue to check our website and our Twitter feed for event updates. Thank you, everyone, and good morning and good evening.